Hello, and welcome to the Malaria Note Book with me, Lilyana Dayo. The aim of this platform is to equip listeners with a simple, basic, and realistic understanding of malaria. The target audience includes policymakers, health professionals, students undertaking medical courses, community health practitioners, and any person who is curious to know about malaria. Today, we are going to learn about clinical management of malaria. The learning priorities will be to review the malaria global burden, review key steps in diagnosis and treatment, recognize signs and symptoms of severe malaria, and identify global best practices for treating uncomplicated malaria. Welcome. So according to the recent World Malaria Report, there are about 263 million cases of malaria that were reported in 2023, with an estimated number of 597,000 deaths. Africa contributed to about 94% of all the malaria cases and 95% of all the malaria deaths. The most affected age group were children below the age of 5, who accounted for 66% of all the malaria deaths, including pregnant women who are also said to be vulnerable. On your right of the slide, there is a map that shows a global distribution of the malaria risk regions, and the most affected part are countries within Africa, mostly south of Sahara, and also countries in the Middle East and some countries in South of America. So about malaria epidemiology, malaria is caused by Plasmodium parasites. So far, scientists have been able to isolate 5 types of parasites. In Africa, the most common parasite is the Plasmodium falciparum, which is the most common and deadliest. Children under the age of 5 and pregnant women, including the elderly and people having chronic illnesses, are said to be among the most vulnerable. Transmission is highly influenced by climate, environment, and human behavior. Mosquitoes thrive best in a climate which is humid, hot, with rainfall. So what are the clinical features of uncomplicated malaria? Any features that I'm going to mention shortly of presenting in a person who has got history of travel to an area known to have high malaria transmission or lives in an area where malaria transmission is known to be high should be suspected to be having malaria. The most common symptoms in most of our patients is fever. It could be accompanied by chills, sweating, headache, muscle pain, vomiting, diarrhea, joint pains, dizziness, amongst other symptoms. Before diagnosing a patient with malaria or confirming the patient has malaria, it is important that the patient undergoes a parasitological confirmation. Most of the countries in Africa tend to use microscopy or the rapid diagnostic test kits for malaria. But there have been recent advancements in technology, and we have countries who are also using molecular diagnostics such as PCR-based tests to confirm malaria. Some use digital tools like artificial intelligence, mobile diagnostics, and also field-based innovations, for instance, through the use of smartphone apps for diagnosis. Once a patient is confirmed to have malaria, it is important that the clinician starts treatment as soon as possible. The first-line treatment in most African countries is through the use of artemisinin-based combined therapies. We have varieties of ACTs, and these include artemether lumefantrine, dihydroartemisinin piperaquine, artemisinin amodiaquine, artemisinin mefloquine, and artemisinin peronaridine, amongst others. It's important that the first dose be given under direct observation. Delayed treatment of malaria can contribute to malaria complications. Patients who receive treatment immediately after diagnosis have got better outcomes compared to those who delay their treatment to a later time. Good practice should be where the patient receives the first dose at the clinic, chemist, or at the hospital. How do we recognize severe malaria? Once again, uncomplicated malaria, when not timely treated, can progress to severe malaria. The following are some of the signs and symptoms of a patient with severe malaria. Anemia, where the patient presents with paleness of the eyes or palms. Jaundice, where there's yellowing of the eyes, and sometimes it can be noticeable amongst in children on the palms. Black water fever, an indication that there could be a probability of acute renal failure. Dehydration, coma, and in some instances, some of the patients die. What are some of the common mistakes that we need to avoid when handling patients in high malaria transmission zones? Assuming all causes of fever are due to malaria. There is a risk of assuming that now that we live in a high malaria transmission zone, that every patient that walks into our hospital is having malaria. It's therefore important that we confirm through a laboratory diagnosis that the patient has malaria. There are some other conditions that do present with fever, but are not necessarily malaria. Frequent treatment before confirming that the patient has malaria. There is a tendency of people living in malaria endemic zones to buy drugs over the counter with an assumption that they could be having malaria. This is risky because it can expose the patient or the population to drug resistance. And then again, not completing treatment. Some patients get tired along the way and give up on completing treatment once they feel the signs and symptoms have reduced. Story time. A 14-year-old boy living in a malaria endemic country presents at the hospital with fever, vomiting, and irritability. The clinician confirms the temperature to be 38 degrees and suspects malaria. He sends him to laboratory for investigations, and the findings indicate that he has Plasmodium parasites. Questions. Was the clinician right to suspect malaria? Why? For yes or for no? What two methods can be used for testing malaria? What are some of the treatment options that can be used to treat malaria? In summary, immediate testing and treatment of malaria saves lives. Treat with ACTs as per the national guidelines. It is important to note that different countries, especially in Africa, have different first-line regimens for treating uncomplicated malaria. Lastly, it is important that all the patients or caregivers need to be counseled to complete treatment to avoid any kind of resistance in future. Thank you. Subscribe for more lessons to the Malaria Notebook. Let's fight malaria one lesson at a time.